So the best way to describe Zone West is as a system, not just simply an intervention. It's a system of linking resources to children's needs. And those children's needs are identified through a relationship with a link worker.
I would say it's all about like early intervention and developing that relationship with the child. A lot of the time people try and fit a child into existing services and provision, and there's room for that, but I think what we do is we build that relationship, get to know them, and then tailor the support to that child.
Yeah, you've been given a lot of time. I think that's what I really appreciated, because sometimes in other services it's very much time bound, so you've got 6 sessions to do boom 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 for an achievement of a target, whereas we've had that time to gently build up that rapport, play lots of games, have lots of fun, and build on the skills that we're kind of developing at each stage before you're really even starting to think about what are the extra needs that you have and where we're trying to help the child move forward to. And that's unique, and that's like something that we need to hold on to more than anything.
So we work in this developmental way with children to prevent complex issues arising. This approach to prevention makes Zone West a form of social prescribing.
My name's Lorna Longworth. I'm a GP at West Road Medical Centre, and I'm the Clinical Director for West End Family Health Primary Care Network. The ways in which we've found working with Zone West helpful day to day as part of a GP practice team is that there's lots of children that we can refer who will benefit from them, and as well as improving the health and well-being of that child and the family and the community that they're part of, it's also helping us with our day job. The types of children that we've found have been good to refer have been those who might have health or behavioural problems that have turned up at the practice and that we are struggling to manage just within our practice team, but they don't really meet the very high thresholds that perhaps SIPs or safeguarding or other services might require. So we've found that referring to Zone West for those children has had really positive outcomes, and that those children do really well with Zone West.
So the assets are things that are already happening, and they might be education resources or health resources, voluntary sector resources, or simply a park that is not being used. Because it's the use that is the critical thing here. For one reason or another, the child is not able to make use of the resources that are around her. And it is our aim, through the painstaking work and of the mentoring work of the link worker, to make the child more able to make use of the resources that are around her. And we feel that they're making a system through which these assets can be accessed and attended. We're making a real difference to the developmental needs of the child.
It's almost like the child needs your endorsement of that service to be able to engage with it, and the parents do as well, because if they didn't have that trust, then it might be harder to sort of like, you know what I mean, like walk into that building or access that like after school club or whatever, you know. So I think it's really important to establish that relationship and to do things early on, like I was saying about before things escalate and you know, before there's more barriers for them to take on part.
Yeah, because I think there's a lot of things, and there has to be like crisis services where people are sticking plasters onto things or trying very much to deal with the crisis at the time, and we're trying to help somewhere along here to try and help prevent that happening in the first place. But I think, like we were saying about the trust thing as well, so the activity that we've been doing over the summer and we're going to continue to do over the summer, the children feel comfortable because they know that we're here and we already knew them, but they also feel comfortable with all of the other providers just by proxy, because it's so all right, well, if you're saying they're okay. And the same as when we're taking them to other assets, or if we're saying to their parents, you know, this might be helpful for your child, that relationship of trust is already established, so it's like, okay, we'll give it a go.
The other great thing about the Zone West project is that it fits in really well with the other priorities that are going on across Newcastle, across Collaborative Newcastle, to do with children and families, and to do with the way that we, going forward, try to tackle the needs around mental health, and the asset-based approach, the individualised approach, all fits really well with those priorities too.